health. The colon is a pretty amazing area of our body, super complicated. I used to work in cardiology, and I commonly say how much more complicated I think the stomach is than the heart. There's a lot more like structure to the heart, but there's so much that goes on in the colon that is difficult to really get a handle on. But let's dive in. So some of you will know this, of course, but I always like to start the talks with anatomy, just because some people know the anatomy and some don't, so I think it's important to kind of cover those structures. So we start in the digestive tract with the mouth. We obviously put food in to eat, and then there's digestive enzymes that are released within the mouth that start to break food down. Then we have a muscular tube that goes from the mouth down through the chest into the abdomen called the esophagus, and that helps propel food down into the stomach. And then the stomach is up in the left upper quadrant of your abdomen, and it moves in a very muscular and intense fashion to start to break food down, so it can be released then into the small intestine. And so the next section is the small intestine, and there are 3 sections within there. The first part after the stomach is called the duodenum, and that's where it starts to neutralize the acid from the stomach and also absorbs certain nutrients throughout that area. It's about 9 inches long, so not super long, but important. And the first aspect of digestion, important for iron absorption. The next section we get into is the jejunum, and that's a very long portion of the small intestine. It's approximately 8 feet long. A lot of absorption happens. It's where primarily most of your absorption of nutrition and nutrients takes place. It's where your fats and carbohydrates and proteins are mostly absorbed. They're also absorbed in other parts of the small intestine, but this is where a majority of your items are absorbed. It's a large surface area for absorption, and there's also some vitamins and stuff that are absorbed in there as well. Then we get to the ileum, which is the last portion of the small intestine. And the ileum is a pretty interesting area. I know this is a very busy slide, so I apologize for that. I couldn't figure out what to put in and what not to put in because there's a lot that happens there. So the ileum continues with absorption. It's very important in absorbing vitamin B12, but it also is very important in monitoring your immune system. There's a big portion of our immune system that actually takes place within the gut, which is, I think, completely fascinating. Like 70% of our immune system is primarily within the gut. And the ileum is a big part of that because the small intestine, obviously food is passing through, and part of the job there is to determine what's friend and what's foe with things that are passing through. It's really pretty fascinating. Primer's patches are part of that immune surveillance system within the ileum. Also in the ileum is where we actually have GLP-1s that are actually released within the ileum. So we do that on our own. You know, that's kind of how that came out. People figure this out. And one of the reasons that for that to happen is it helps with satiety, so when you feel full or satisfied. There's other peptides that are released in that portion for the same reason. And eating slower helps release those, so that's one of the things we can actually do on our own. But we all eat so quickly nowadays. We talk about this at home a lot because we're also so rushed. You know, we always eat very quickly. But anyway, that's for another time. But it's really fascinating how much actually happens in that part of the small intestine. Then the ileum goes into the large intestine, and on the right side goes into the cecum. And if anybody's ever had their appendix out, that is on the right side of the abdomen. It's attached to the cecum. Then there's the ascending colon, the transverse, which goes across the middle, the descending, and then the sigmoid colon, and then you get to the rectum and the anus. So that's the basic anatomy for the abdomen. You do have a couple other organs, just to mention them. Of course, you have the liver in the right upper quadrant. Underneath the liver is where the gallbladder sits. And then the left side of the abdomen, you also have the pancreas. So a couple other things in there. So just to talk a little more about the large intestine, one of its primary things is absorbing water. It absorbs most of our water that we take in, 1 to 1.5 liters per day. There's some other vitamins that get absorbed or created. But also it's to form stool to get rid of the toxins that we're not using for nutrients in our bodies. One of the things people talk about a lot nowadays is the gut microbiome. We'll just touch very briefly on this because it's just a small portion right now. But there are over 1 trillion bacteria, and I don't know how we got that number, but it's a very high number. But there are 1 trillion of bacteria that live within our gut that if there's good bacteria, it is incredibly beneficial for our health. If there's bad bacteria, it can be bad for our health. It's pretty fascinating. Fiber is a big part of that, and we'll talk more about that later. So, let's get to the meat of the talk, colon cancer. So what is the prevalence of colon cancer? Well, it's about 1 million to 1.5 million people in the United States. There are about 153,000 new cases of colorectal cancer per year. A little over 100,000 are colon, about 50,000 are rectal cancer. It's one of the second leading causes of cancer deaths in the United States. It is something that's been shown to be increasing in the younger population in both colon and rectal cancer. They're not really sure exactly why those prevalence are increasing in the younger. They don't know if it has to do totally with diet and how things have changed so much in that aspect, if it's lifestyle or just various things, but they've noticed there's been increasing incidence in younger folks. So how does colon cancer happen? I thought this was pretty interesting because I've not really thought that much about it before all of this, but it reminds me a lot of the things that take place within our body. So the lining of the colon ends up with an injury or some type of abnormality that occurs either from inflammation, which makes our tissues more friable, or a toxin that passes through and causes an abnormality within that area. So then cells start to proliferate or increase in their growth. And then there's different pathways from that point where things can take place where these cells can proliferate or grow faster or more so, basically. And basically, there's certain things within our different lifestyle things, and we'll talk about that in a bit, that can affect how those cells change and how quickly they can regenerate or grow, basically. In stage 3, I thought this was fascinating. There's a loss of what's called the tumor suppressor cells. The guardian of the genome is really what the name is. Did not make that up. They're also listed as P53s. But these are things that normally have the ability to kill off abnormal cells that occur within the colon. But there are certain things, and we'll see that in a bit, that can affect their ability to do that. And then ultimately you can develop into an invasive cancer. Very briefly, we'll just talk about, this is a little bit of a busy slide, but the types of colon cancer. Adenocarcinomas are most common. There are carcinoid tumors. There are gist cell tumors, which are gastrointestinal stroma tumors, lymphomas, and then sarcomas, just to touch on those. So symptoms. How can you tell that you have colon cancer? A lot of times the answer is no, not exactly. There's a lot of stuff that can happen in your abdomen that you just don't really know that it's going on. And that's why screening is so incredibly important for colon cancer, to make sure that things are found early when they're very treatable. You can have a change in your stool. That's one thing. If you had, you have normal stools for the most part, and then you suddenly start having what we call pencil thin stools. So they're very small in caliber, meaning small in diameter. The color changes where you start having red stools. They look like the stools on the table. Those are very abnormal, except for the brown ones. But things that are different. Those that happen for over a day or two. I mean, our colon is very variable. We can have diarrhea or constipation, and that's normal. But if it's something that's going on for weeks, that's something that needs to be looked into. Another thing is weight loss that's unexplained. Those are things that are important. And that doesn't always mean colon cancer, but if you are not trying to lose weight and you're noticing, like, man, I've lost 20 pounds and I haven't been doing anything, that's something that needs to be investigated. Abdominal pain is not common, but potentially. Blood in the stool is one of the other big things. And sometimes that can be black stools. So it doesn't just mean it has to be red, it could be maroon or black or just dark. Risk factors. So those are the important things because some of them we can modify and some we can't. Age, as we get older, we're all at risk for certain things. Colon cancer is one of them. Family history, there's a strong prevalence of family history, especially if you have a first-degree relative, you want to be more aggressive in screening. There are some genetic tendencies, so some families have strong histories of multiple types of cancer. One of them is like Lynch syndrome, where there's early onset of colon cancer or uterine cancer within the family. You want to get tested. You can have genetic testing through your primary or through other. There's actually more websites nowadays that you can do it. I don't have those links here, but that's something that are available. And you don't have to have one from your primary, but you can Google, how to be tested for genetic issues, and you can, especially even breast cancer. That's a big one that's out there. Inflammatory bowel disease certainly increases the risk of colon cancer, and I think it's related mostly to the inflammation that occurs in those diseases. So modifiable, those are the big ones. So things we can try and change. So low fiber diet. So high fiber diets, one of the things that's really important and why fiber is so crucial kind of for us to take into our diets is it really feeds those good gut bacteria. And when you feed the good gut bacteria, it creates certain different enzymes, or there's a certain one called butyrate, which actually helps stabilize colon cells and keep them from having inflammatory changes, and it's a very beneficial gut microbiome. And a thing that the gut microbiome releases, and it feeds off of fiber. All of those good bacteria feed off of different types of fiber. So this is where the P53 part comes in. I thought this was really interesting. So smoking increases our risk for a lot of things. The inflammation within smoking causes a lot of inflammation within the body, and that can then lead to things like colon cancer risks, other cancer risks, coronary disease, but certainly it can affect colon cancer. High processed meats, or high processed diet, and processed meats, they both, again, affect that P53 component where they monitor and try and get rid of the abnormal cells. They can affect how well those work, and there's certain chemicals in how processed meats and smoked meats, because a lot of times they're cooked at very high temperatures, they're infused with nitrates to try and preserve the food longer and to give them certain colors, and those all can have negative effects on some of those stages that would then normally get rid of those abnormal cells. Truncal obesity, that increases your inflammation, all of that. That's unfortunately, visceral fat is very pro-inflammatory, and it tends to increase our health risk for a lot of different things. Sedentary lifestyle. So, and we'll see in the next slide, but exercise is one of the most important things for decreasing your risk of colon cancer, outside of probably quitting smoking, but it is a big, big component. Controlling diabetes, and then this is really interesting, oral hygiene. So I did a talk a month ago on coronary disease, and people talk about that, like there's this correlation between bad gum health and coronary artery disease, but there's a strong correlation between colon cancer risk and bad oral hygiene. They're actually noticing that in some colon tumors, there's certain bacteria that are in your mouth that they're finding in these tumors. And so they're talking about trying to use those actually as some of the markers to test in the future for colon cancer. I'm like, whoa, a floss out. But I was really surprised that the 43% increased risk for that if you have bad dental hygiene. I was really blown away by that. So modifiable, we kind of went over these already, but smoking increases your risk by about 20-30%. If you're a heavy smoker, it can be up to as much as 40 to 42%. Quitting definitely decreases that risk though, so it helps for sure. And again, increased activity, that has been shown to be one of the number one risk modifiers to decrease your risk for colon cancer. Nutrition, of course, we kind of touched on this. So the other thing about fiber, not only does it feed the good microbiome, but it helps in the transit time. So one of the things they've noticed, if you have slower transit time, you have more toxins in the colon for a longer period of time. And they're thinking that may affect the effect on the inner lining of the colon, which then can cause those abnormal cells to then proliferate. They all talk about the Mediterranean diet. Mediterranean diet is the diet for everybody. I mean, coronary disease, colon health, issue, all of that stuff. I think the Mediterranean diet, you see it in every single thing that people talk about. So it's definitely a very healthy diet to follow. We talked about oral hygiene, of course controlling your blood sugars if you're diabetic, and then again metabolic syndrome. So screening. Screening should start at the age of 45, unless you have a first degree relative. That means brother, sister, mother, father that's had colon cancer. Then you start at the age of 40 or 10 years prior to them being diagnosed. Different screening tests. There's something called the FIT test, which is basically looking for blood in the stool. There is the Cologuard, which is every 3 years. So that looks for blood in the stool, as well as DNA that the cancer cells will shed into the stool. So they're able to test for that, and that's why it's more accurate than just the blood in the stool, and why it's actually a pretty darn good test to use. I always wondered, you know, like, it seems kind of like you're taking the easy way out, but actually the specificity is about 92%, so it's really pretty good. And then colonoscopy, of course, and then there's CT colonography, which is something I don't think we do around here, but it's a CAT scan that you can have done. You don't have to be sedated. You do have to do a colon prep for it. Air is insufflated into the colon, so you do still have that done. But it's, once that's done, you're just going through a CAT scan. But I don't think anyone up here does that. I've actually not heard of anyone doing that around here. So since we've talked about this as part of it, I just thought I'd put that up there to kind of compare the two. So again, Cologuard is actually way more effective than I actually would have thought it would be. Can detect 9 out of 10 colon cancers, the 92% sensitivity. I'm sorry, not specificity, but sensitivity, meaning that it's going to be positive more often. It may not always be right, but it wants to at least know the higher, you don't want to miss colon cancer. So the sensitivity is very high. The pluses, of course, is there's no colon prep. You can do it from the comfort of your own home. So there's definitely, the most important screening is the one you're actually going to do. So that's why they say, you know, this is certainly a good option. It is definitely not for people with a history of colon cancer or somebody who's had a previous precancerous polyp on a colonoscopy, or first degree relatives. It's not going to be recommended as your first line screening. You're going to want to do a colonoscopy. And then of course colonoscopies are still the gold standard, if you will. They're 95 to 99% sensitive because you're having direct visualization. The biggest risks, of course, is you have some sedation, so you have to go through a procedure. You do have to do a bowel prep, which everyone hates. Then you have the risk of bowel perforation, which is pretty low, but if there's some undiagnosed issue going on, that can happen. So it's not a risk of 0 for sure. So diagnosis, colonoscopy still. So if you have a positive Cologuard, you still then have to go on to have a colonoscopy because they need to see what's causing that test to be positive. Then they would biopsy something that looked abnormal, and usually if they see a polyp, they biopsy or remove it either way to make sure that if it is abnormal, they can actually treat basically your colon cancer prior to it becoming an issue. Hemocult is another way of testing for blood in the stool. And then, and this sounds weird, but, oh, I'm sorry, I skipped over bowel obstruction. So, I also work with general surgery at the hospital, and every once in a while you have someone who comes in with a bowel obstruction and they haven't, it's our first question, have you ever had a colonoscopy? And if they say no, then you think, oh, well, we need to kind of look at that, because if you do have a cancer, it could be obstructing the colon, and again, you may not have ever known because it could just be in there doing its happy thing and, until something goes wrong like that. And then every once in a while, someone who has their appendix removed, they have a cancer in there. It's uncommon, but it can be in there. treatments. Now, I'll touch on this very briefly because this is obviously guided by an oncologist. But colonoscopies can be treatment as well because they can remove polyps that may be precancerous. Surgical resection, meaning cutting a portion of the colon out that has an abnormal mass in there. Chemotherapy, obviously that would be guided by an oncologist. Immunotherapy, by an oncologist. And radiation is uncommon for the colon itself, but more common for rectal cancer. Prevention, of course, that's always the goal. We kind of touched on this already, but regular screenings, number one. Regular exercise, super important. Eating a high fiber diet with various different vegetables if you can, because that's what really helps flourish the gut microbiome. Diabetes in control, and stopping smoking.
So Jen touched on the importance of the gut microbiome. So all the microorganisms, those trillions of organisms that are there living and helping support our health. And so these substances that we're going to talk about now really have a positive influence on the balance of those bacteria and other organisms in there and help them thrive, so they help us thrive. So we're going to talk about what they are, why you should use them, how much, and then there are some times when we need to avoid some of those substances. So probiotics have been talked about starting back in the early 1900s with a Russian zoologist, and he studied longevity and immunology. And he figured out as he was studying these Bulgarian peasants that those who drank, there was a special sour dairy product that they drank that had a lot of bacteria in it, and the ones who did lived longer and were healthier. And so that went into his study and actually eventually won the Nobel Prize for medicine and physiology for some of his research. And you can see then in the rest of the slide how in the last 30 years it has exploded. What's been studied, what are we now are understanding about the prebiotics, probiotics, and postbiotics. They have new definitions that are more scientific and a little bit more rigid. And we're understanding more and more about what they do to help the body. So we'll start with prebiotics, and these are non-digestible components. So in other words, pieces and parts of food that the microorganisms in our gut then use. They break down, they ferment them, and they create these other chemicals. Jen mentioned the butyrate, and then there's several other substances that they create when they break down these prebiotics. So they're mainly found in fiber-rich plant foods. They, again, they're non-digestible, so they pass through the upper GI tract, and then they get down to the colon, and that's where they start to be food, basically. There's small amounts in the food substances that they're contained in, so scientists have figured out how to create them on a larger scale so that we can purchase them and get them in a supplement form. And we already know that they have a lot of benefits for the body, but they're, again, ongoing research. They're not regulated by the FDA, so you're going to get a lot of differences in how they're presented and how they're studied, but there's a special society that's really trying to come up with the best and most consistent definitions and expectations of the research that's being done. So these are some of the sources of prebiotics. So you have apples, berries, the oranges, watermelon, cabbage, onions, pumpkins, sweet potatoes, beans, legumes, nuts, and even cocoa powder, so you can get some in your chocolate, and then seaweed, and even breast milk, they're found, some of these prebiotics are found. The ingredients or the substances that the prebiotics are broken down into are the one that we know the most about, that we hear about when we're at the store and seeing things on the shelves for gut health, inulin is the most common one that we see. There's a couple more that are way more complicated, chemical names. But basically, these ingredients then are put into other products. So they put these substances into, the prebiotic substances into biscuits and cereal and chocolate and spreads and dairy, so that we're getting these components in some of the other food that's fortified in there. The recommended dose for the prebiotics has been established by that special committee I was talking about that's really doing a lot to put a lot of attention behind the prebiotics and pro and postbiotics. So you can see there's a range there for what's needed to cause good effects in the body, and that recommended daily dose is right in the middle of that. But even saying that, some people do get some side effects even in that recommended dose. But there's several things that probably look familiar to you. That large green bottle on the left side of the screen, that's Benefiber. So that has the prebiotic components in it. And then the company that makes Miralax makes Mirafiber gummies that have prebiotics in them. And inulin, you can see a couple different products there. And then this is one of those other chemical names that contains the prebiotic components. So there's lots of ways for you to get the prebiotic into your diet if you're not getting it, if you're not eating all of those vegetables and beans and nuts and everything that are that I listed as those other sources. So what do the prebiotics do for us? So you can see there's actually several different systems that the prebiotics have a good effect on our body. On the bottom left, you see the gut health, which we've started to talk about a lot with Jen's discussions already. It really supports the microbiota that are growing, all the microorganisms in our colon. It helps decrease cancer risk, irritable bowel symptoms, and episodes of Crohn's disease. But I was fascinated, as Jennifer was with her research, that it also has some great effects on skin. That it decreases your risk of dermatitis and helps the integrity of the skin. It also has great effects on the immune system. Jen was talking about in the jejunum that there was a large activity on the immune system, and there we are. The immune system is affected by these prebiotics as well. We know that it actually can increase the benefits that we get from the influenza vaccine. It decreases our side effects with it as well. It also can decrease the need for antibiotics with some infections, not everything. It certainly would replace antibiotics, but can decrease how much we need them. And also can decrease the duration of disease. And one of my favorite benefits up in the upper left is on the neurologic system. So there's definite evidence that it has a positive influence. These prebiotics have a positive influence on our cognition and our recall, short-term recall. It's not shown to have benefit in helping with long-term recall, in other words, recovering memory that you've lost, so it's not going to be a treatment for a dementia or something like that. But using them on a regular basis, you're going to feel sharper and have better concentration. So I'm going to definitely increase them in my diet. And also with overall just health promotion. The other thing is benefits on the cardiovascular health. So by affecting the LDL, there's also a benefit on the total cholesterol and then also the triglyceride levels. So lots of good reasons to be making sure that these are in our diet on a regular basis. Additionally, there's been some studies in mice that have not been duplicated in humans yet as far as improved mood and stress hormones, but the research is there's some of the articles that I read, there's just tons and tons of studies that are ongoing. So we're going to see some more benefits, I'm sure, in the future. There are some side effects, but they are generally not considered serious, but it's basically because they're used in the gut, so your gut's going to be more active when you're taking in these prebiotics that you might not have been used to before. So some bloating, some cramping, some flatulence, and potentially some looser stool, osmotic diarrhea, because it's pulling in some water as it moves through the gut. And again, it says here that even in the therapeutic range, you can have mild to moderate side effects. So we think about just with any medicine or new substance we're introducing that we start with a small amount and gradually increase to hopefully build up your tolerance for it. So we'll move on to probiotics, which are actually live microorganisms. So we're talking about, those are the microorganisms that we already know we have in our gut, and then we can introduce them in some of these substances. We can add more of these microorganisms into our system. They have wonderful effects also on the system, on our overall health, but it's very complex how they do that, and there's many different strains or different varieties of the microorganisms. So some of the health effects are specific to those specific strains. They have benefits. These probiotics have both positive and negative benefits, meaning that they add things to the system and then they subtract things from the system. On the subtraction side, the right side, they actually can remove harmful metabolites from regular food that we eat, or also if there's some kind of chemical or heavy metals or something that we've been exposed to, they actually have some benefit in removing those from our system. And then on the positive side, or on the left side of the screen, you can see that they add in antimicrobial, so they're having a positive effect on our immune system. They, again, introduction of additional microorganisms into the system, so they're helping with the balance of all of those that large microbiome we have. They also help with the intestinal mucosa, so it is probably heard of, I'm not going to go into the definition of leaky gut, but we've probably all heard of that when we've talked about colon health. And when we take these probiotics on a regular basis, either in a supplement or in a food form, then we are actually promoting the integrity, or how strong the epithelial lining is, in preventing some of those things from leaking out, those metabolites, those bad things from leaking out of our gut. So lots of positives from those microorganisms. So you can see these are the most common microorganisms that we think of and recognize, the lactobacillus, the bifidobacterium, enterococcus, streptococcus, and the yeast. And as we're going to actually see a label pretty soon, so we'll be able to recognize some of those from and I actually have a couple samples of things up here that we can try later that list those species in there. These are some of the ways that we can get this in our food. Yogurt, kefir, sauerkraut, kimchi, miso, tempeh, cultured dairy products. Even some cheeses have some probiotic benefits to them, but it's usually in a small amount. If we're going to really get something out of it, we're going to have to get it from some of these other products. We do know that probiotics have a huge effect. This is proven, definite science already, on infant malnutrition, so they're added to infants who are having failure to thrive, and they will actually show, weight gain and improvement. When given with patients who are undergoing immunotherapy of melanoma, there's increased benefits. They actually have a better response. It can help with elevated uric acid levels, so bringing those levels down, which will have an effect on gout and other metabolic issues. And then again, I mentioned earlier the heavy metals, so other toxic substances that we may have ingested. It actually helps reduce the levels that are in our system, as well as, if we've already been exposed, what bad effects we might have. And I just love that all the science that, I wish I would have invested in this stuff a long time ago, because there's so many potential benefits. Jen talked about the oral health, and gum disease and cavities are on there because the probiotics have, there's definite science behind the benefit for those. Even acne and other skin conditions, the atopic dermatitis, and then the obvious bowel related issues with the antibiotic associated diarrhea, inflammatory bowel disease, and irritable bowel syndrome. So So these are the different sources of the probiotic foods we mentioned earlier. There's also, meal replacements that are out there, the dietary supplements that, most of us have seen advertised, the Culturelle, the Flora Store, which is the one that we use at the hospital most often, and Align. And then there are prescription drugs that are, so prescription strength probiotics as well. So as you're just trying to decide which probiotics to take, or if you're going to actually get them when you're looking at a product, you want to look for live and active cultures on the label. That is definitely, that's for the probiotic portion, that's what you want to see. And you, again, start small and introduce gradually, and you want to avoid overheating because that will actually kill the organism that you're trying to introduce into your system. And then, for a combination, you want to eat the prebiotics to feed the probiotics, because the probiotics, again, are the organism that's already, you're adding in more, but there's already some in your gut, and you eat the prebiotics and they have food and everyone's happy. Couple things here. Multiple strains are likely more helpful than a single strain product. So sometimes you see a product that just has the, like this one here, just has the Saccharomyces, the yeast. But unless you know what you're missing and what effect you're trying to achieve, it's unlikely that you're going to get it with that single strain. So you need multiple strains, you need multiple different organisms in the supplement, in your foods, to be able to likely achieve benefits. And so this is that label that I was telling you about earlier, and you can see the green highlighted area are all the different species that are in this product. This is a multi-species product. And it gives the count in the yellow highlight there, the viable count, which is how much, if that's set on a shelf for 3 years or whatever the shelf life is, how much they expect there to be at the end of that shelf life. And the amount isn't always the most important part of how you get benefits, but it can make a difference, and you can use that for comparison from one to the other, and then the recommended dose on there. The only thing that I wasn't able to see on this label was how to store it, because there are some products that require refrigeration, but most of the supplements that come like in the capsule form do not. And this product actually also has the prebiotic in it. So it's your food for your probiotic right in there. This was a fabulous resource. So if anybody's writing things down and wants to try to figure out what probiotics to get, you want to just take that top line, the usprobioticguide.com. I'm going to open it up so you can see. But it's a fabulous website that anyone can interact with. It's I think it was originally created for clinicians who are prescribing the probiotics, but this is now open to the lay public to be able to look at, to use to help with. Oh, it's not showing it. Why is it not showing it? Because it came up on my screen.
Sometimes you have to exit out. I don't know why.
Darn it.
Like quicker than my writing.
You do both.
Our phone's great.
All right. Well, trust me that if you go to that website, there's a Canadian version for the products that are available in Canada, but this is specifically to, products that are available in the U.S. And you can use the website to pick what condition you're trying to treat or what health benefit you're trying to achieve. And it gives you suggestions and the science and the dosing and everything. So it's a really, really helpful, because there are so many products out there. Excuse me. I walked down the Meijer aisle tonight before I came here, and there's just so many options for probiotics alone. And then when you add in the prebiotics and the postbiotics, etc., it can be overwhelming. Yeah. So this is a way to help you with the science to figure out what product might be good for you. And again, everyone has an individual microbiome. Mine is different than Jen's, than Kevin's, than anybody else who's in the room, and it's partly based on your genetics, the foods you eat, and medicines you take, etc. So what may work for me may not work for you. So sometimes there's some experimenting that you have to do to be able to. Oh, look at that!
I'm not
It's
sure
listening
how
to
to
you.
I don't know how I did that.
I don't either, but it's okay. There we go.
Okay, so so anyway, that's a really helpful website, and I did utilize it earlier when I was working on the talk. There are some medicines that have a negative effect on the microbiome, so the microorganisms are either not as healthy or not in the right balance, and actually all of them are fairly common, unfortunately. The proton pump inhibitors, so we're talking about things that we use for ulcers or for reflux symptoms, like omeprazole and Nexium and Prevacid and things like that. They can actually decrease the amount of the microbiome that is functional in your gut. And then metformin, which we use for diabetes and metabolic syndrome, can have a negative effect. And then laxatives obviously can clean you out for better or worse. And then chemotherapy if you're undergoing cancer treatment. So it is worthwhile asking your provider if it's appropriate to be off of one of the medicines, or to add in the probiotics to supplement and get back to the right balance of the microbiome. In the definition of probiotic, it was a live microorganism. So these are things that can cause infection in too high of a count, or if you're immunosuppressed. So patients who have HIV positive or undergoing cancer treatment or immunocompromised, like they're on medicines after a transplant or something, are at higher risk of these kind of infections with the probiotics. So you definitely have to be super careful in these situations, and if any of these syndromes or issues look familiar, then definitely asking your provider before you start taking a probiotic. All right, so we talked about prebiotics, so that's the food. For the probiotic, which is the microorganism, and now we're talking about the postbiotic, which are the inanimate, so dead, not live parts of microorganism or their components, but they still have a benefit for our gut, and for the rest of us. And they are created by metabolism that the probiotics or the microbiota, the gut organisms, perform in the colon. So some of postbiotics, and this was a new term to me, I had not heard of this before I started preparing things for this talk. So some of these look very familiar, right? So vitamin B12 is actually something that your gut can create with the right combination of substances, vitamin K and folate. And then some of these other substances that we talked about earlier that Jen mentioned and I did too, these short chain fatty acids that are created, and then enzymes and other substances. What's great about these products is that these are non-viable, so these are not alive. These are things that are not going to cause an infection in someone who already has, a risk of infection because they're immunocompromised or they're very ill. And they're stable across wide temperatures and pH ranges, so they're easier to store. This is something that we can keep for a long period of time. And they're still studying these. This is something that really just was defined within the last 10 years, these postbiotics, and we don't know why all of these things happen, but the science is already starting to come in on all these beneficial effects that the postbiotics have. So they're antioxidant, anti-proliferative, and that means that it has an effect on things that are growing rapidly, i.e. cancers. Antimicrobial, so it helps with infection management. Anti-diabetic, so again, lowering your risk of diabetes, lowering your glucose. Immunomodulating, so helps with the immune system, lowering cholesterol, antihypertensive, and then has a positive effect on weight. And the slide is divided on which portion, which parts of the postbiotic has those effects. But altogether, you're getting most of those, you're getting both components in whatever postbiotic product you're gonna have, so you're gonna get all of those effects. There's also commercial applications of postbiotics, which I found fascinating. It's actually being included in food packaging now to help with food preservation, and also the nutritional benefits. And then it's being added into cosmetic formulations, so shampoos and face lotions, etc., because it has an effect on the bacteria balance of our face, of our scalp, and then also in toothpaste. I actually even have a sample, I forgot to put it out. But I started using this toothpaste called Feed Your Good Guys, and it has prebiotic and it has prebiotic components in it to help with your oral health and therefore, you know, downstream your gut health as well. They've been using it in veterinary medicine because it actually reduces the need for antibiotics in treatment of mastitis for the cows, for milk-producing cows, and then also helps with growth of the animals. So I just like so many options for these chemicals. Again, I wish I had invested a long time ago. These are some of the products that are available, you know, fairly universally. Again, all postbiotics there, and pretty easy to get your hands on. So the last portion is about fiber, and the health effects really depend on, you know, what you already have in your microbiome, and how that fiber interacts with it. There's soluble and insoluble fiber, and they have different benefits. And again, you're going to probably get both types of fiber in your food stuff that you're getting, not unless you really through, you know, processing really distill it down. You're going to get both benefits. But the soluble portion, again, it dissolves in water. That's the definition of soluble, and it will slow your digestion. So you find it in the grains, the seeds, the legumes, fruits and veggies, nuts and psyllium, and it has some obvious benefits there. So lowering risk of heart disease, decreased cholesterol levels, and better glucose control. So, I mean, what's bad about that? Nothing really. And then the insoluble fiber. So this is fiber that does not dissolve in water. So it passes through, it acts as bulk to help food and waste pass through the gut more easily. So it's really helpful for constipation, and you can see that, you know, it's found in the whole grains, the beans, the root veggies, and the nuts. And this is, again, why would you not want to eat fiber after you look at this list of benefits? So it supports weight loss. Because it is a not energy dense food stuff, it takes longer to eat and it's more filling, so you feel that sense of fullness faster. It decreases the LDL cholesterol because it is less reabsorbed. It also slows the reabsorption of glucose, so again decreases your risk of diabetes. It helps with colon health, as we've talked about multiple times now. And we didn't talk about, are you going to talk about hemorrhoids or anything like that, or diverticula?
No,
Okay.
diverticula, yes.
Okay,
Hemorrhoids, no.
so the fiber actually decreases your risk of hemorrhoids, which, you know, which is a blood vessel that is large and enlarged at the end of your colon, so in the rectal wall. And also a decreased risk of diverticulosis, which is a small outpouching of the colon wall. So again, benefits there. And then the decreased risk of colon cancer. Less chance of constipation, and actually can do the opposite and decrease loose watery stools, so help bulk up your stool. So multiple benefits. And again, why would you not make sure that it's in your diet? So the recommended daily allowance is based on your age and your sex. So if you're a woman less than 50, it's 21 grams. If you're greater than 50 years old, then it's 25 grams, and you can see the numbers there for the male. So as you get older, the more fiber we need. Taking it in supplements is not as good as getting it in your whole foods, all of those foods that we have listed here for options for getting your fiber. But if you are looking at a label to find fiber that's actually put into your foods. The ingredients that you're looking for are down there at the bottom, the chicory root, cellulose, and pectin. Those are the ingredients, the fiber ingredients that will be added to foodstuffs. And as Jen mentioned, a refined or processed food is very low in fiber, so you want to be adding some in if that's what, or avoiding those foods altogether. So I found this guide. Oh, this did not display very well at all, unfortunately. But I found this on Etsy, ironically, and it is a list of fiber food contents by category, and so it tells you how much you need to get whatever grams of fiber it lists, and it tells you whether you're getting the soluble, insoluble, or both fibers. And then the highest fiber content from the list, which you guys can't read it at all. In the fruits, it's guava has the highest fiber content. In the vegetables, it's artichoke hearts. In the cereals and grains, it's bran cereal. In the legumes and beans, it's black beans. So those are very easy ways to be adding in fiber to your diet. And again, getting it in the whole food rather than in a product. Again, some side effects with fiber, the same thing that we're talking about when our colon is more active, the gas, the bloating, the cramping, and there is a list of patients who should not be taking extra fiber and might be, actually should be on a low fiber diet. It's important to drink lots of water when you're taking fiber, and again, start with small amounts and gradually increase it to help your tolerability. So, the conclusions are that a balanced gut microbiome is integral to overall health and well-being. We're finding that more and more being important. All of those products that we've talked about for the last few minutes provide multiple health benefits and generally come with very few side effects, and if they are, they're not really serious. There's a lot of ongoing research, and we're going to be able to be more specific and figure out what's going to help you versus you based on the combination of microorganisms that we have. But there's no really downside to these products at this time.
Colon things that we'll talk about, general stuff. Dr. Naylor mentioned leaky gut. I did not put that in here, and there's also something called SIBO, which is small intestinal bacterial overgrowth, which is another type of small intestine issue. But if someone ever has questions, we can certainly do more information on that. But we could talk about colon stuff for a long time, and I didn't want it to be too long. But those are very important concerns. So, diverticula. Yes, you did talk about that because fiber does really help reduce the risk of diverticula. And so what are diverticula? They're little outpouchings. So our colon has like these little scalloped areas within them. They're shaped that way. And where the colon comes together is where a lot of the blood vessels go through the colon wall to provide blood supply to the colon. And so that is an area of weakness within the colon wall. So as the colon's squeezing down, if there's increased pressure within it, the best way to think about it is, I have this little squeezy guy. I figured the best way to kind of show you if your colon's squeezing on bulky fibrous stool, it doesn't squish as much. But if it has doesn't have that bulky stool, it really has to press down, and you get these outpouchings in between the areas where it has a weakened area of the colon wall. And that's basically how these things can happen for the most part. Now, there's some familial or genetic tendencies towards this too. There's actually familial polyposis, or polyposis, I think that is it. But those people can have the tendency more so. But fiber does really help reduce that because, again, it bulks up the stool and doesn't have the colon have to squeeze down and increase the internal pressure of the colon as much. And they happen more so in the sigmoid colon because that's actually the smallest in diameter for the colon, and that's why they tend to happen more so in that area. So commonly people have left-sided abdominal discomfort if it starts to become inflamed. So what can happen, those little out pouches are kind of like an appendix, if you will. So if you have the ballooning, you have this ballooning little shape, it has a hollow center, And so it can collect bacteria into that, and if the bacteria can't get out, it then festers and can turn into an abscess or an infection. And that's what diverticulitis then turns into, is the diverticula becomes inflamed and turns into diverticulitis. It's actually pretty common, unfortunately. We see a lot of people, I mean, you see them in the hospital, but it's more common than I guess maybe we just see them a lot, but it seems to be pretty common. And you'll see it on a colonoscopy. So if you have a colonoscopy done, they should be able to see if you have a lot of diverticula or a few. And some people can have diverticula their entire life. Doesn't mean you're going to have any problems. It just means that they're there. But yeah, and again, fiber is helpful. So if you do get the infection, sometimes it can just be treated with antibiotics. Sometimes if people they'll see the primary, they have left-sided abdominal pain, they have a history of diverticulitis, they get put on antibiotics, and then it can get better. If that doesn't happen, it can actually get to where one of these gets bigger and bigger and becomes inflamed, and the wall thins and weakens, and it can rupture, which can then cause an abscess within the abdomen. So that's why you try not to develop these little diverticula if you can. But again, sometimes we can't always completely keep these things from happening. And there used to be recommendations not to eat seeds, not to eat popcorn, not to eat certain things because they thought they had an increased risk. But that's been debunked, and it's now, if you know something triggers diverticulitis, then don't do it, but there's no specific link to those things anymore. There aren't any recommendations from that. Abdominal pain. So I just brought this in because there's a lot of different things that can cause abdominal pain, because the abdomen in general is very tricky, and so we see a lot of people who come in with these kind of diffuse complaints. In general, if you have right lower quadrant pain, that generally tends to be an appendicitis. It can also just be constipation though. Constipation, inflammation, and obstruction can cause pain pretty much anywhere in the abdomen. For right lower quadrant, we think gallbladder, or potentially hernia, but usually appendix. Right upper quadrant, which is where the liver and the gallbladder live, that's where you kind of think of gallbladder issues. Again though, it can be constipation. We've had people in the hospital who thought they had gallbladder issues. They were just really backed up. And once you got things moving, they were fine. So it's amazing how much constipation can really affect abdominal symptoms. Mid-epigastric, so that's kind of in the middle. That's where people will get heartburn sometimes if you have reflux, or reflux where you're on protonics or different types of acid reducers. You can also have ulcers that you can have discomfort in the mid-epigastric. Left upper quadrant is where your pancreas is. So even in the mid-epigastric, you can have inflammation or pancreatitis, sometimes cause pain there. Ulcers within the stomach can cause in the left upper quadrant. And then left lower, we talked about diverticulitis is the most common. This is where you're gonna have pain for that. One other thing that I don't think people talk about that much, which is why I brought this up, your colon and your small intestine have a very robust blood supply. So we all know about coronary disease and blockages that can happen in the arteries of your heart, as well as the arteries of your legs. But you can have this happen in the arteries that lead to your gut as well. So the symptoms that people may not think about is if you have pain at 30 minutes or so after eating, like with every meal, it's because your colon is requesting more blood, but the arteries are narrowed and it's not supplying the blood that it necessarily needs. It's kind of like having angina or chest pain, but it's within the abdomen. It's if it gets to where you're like, oh, you don't want to eat, people are losing weight, those are times when you really have to have something evaluated and make sure that somebody evaluates the blood supply to the gut as well. Especially if you have risk factors like smoking or coronary artery disease or blockages in other places, you have to always think that it could happen in the abdomen as well. Oh, that's just a CT. It's a weird CT, so we can always go back if someone wants to see it, but it's not, it does have kind of a cool, all right, I'll show one part of it. It's kind of weird, but The one thing I think is interesting, darn it, if I get it to work. So in here, this is like the blood supply to the colon, which I thought was kind of a cool picture, because you can kind of see how robust that blood supply to the intestine really is. So, but we'll go on. It's a weird CT anyway. So, irritable bowel syndrome and irritable bowel disease. I figured we'd touch a little bit on these. They're actually quite prevalent. Irritable bowel syndrome is quite common in the US and actually worldwide. They feel like 1 in 10 people may suffer from irritable bowel syndrome to some extent. It is different in that it tends to be more of a functional component. It's not as much noted as an inflammatory component, where irritable bowel disease is an inflammation of certain portions of the bowel. So irritable bowel syndrome, usually you have to have abdominal pain as part of the constellation of symptoms. Usually have bloating, gas, you can have diarrhea or constipation. You can actually have both. There are 4 different types. You can have IBS-D, which is diarrhea, IBS-C, which is constipation, IBS-M, which is mixed, and then there's IBS-U, which is undiagnosed. I mean, there's all these different, I'll tell you, the bowels are very complicated, but it is very much linked to anxiety and stress. And I don't say that anxiety causes it, but there's a very strong connection between high stress levels and anxiety levels, as well as lifestyle concerns that increase your risk or the tendency towards irritable bowel syndrome. Treatments, as Dr. Naylor talked about, is fiber, because it helps feed the good microbiome. Stress management, which is really important in trying to mediate your stress levels with breathing exercises, vagus nerve exercises, which are in the packets that are in there. There's different things you can do that have in some of the handouts in the information. One of the things about irritable bowel syndrome, the symptoms seem to improve after bowel movements. And people will tend to start to know triggers, but they will also end up on a further exam, they'll have a normal colonoscopy. It can be tough though, because with irritable bowel disease, very common to have blood in the stool. Irritable bowel syndrome, not as much, but it doesn't mean you're definitely gonna have blood in the stool to have one irritable bowel disease. So sometimes it's difficult to kind of figure out one from the other without direct visualization of the colonoscopy. So irritable bowel disease, again, is more immune mediated. It's treated differently. A lot of times people need to be on immune modulating medications. And I was thinking about that when you were talking about the probiotics and prebiotics, and you know, if some of those are some treatments for irritable bowel are immunosuppressive because it is immune mediated. So it's kind of a tricky situation in those arenas. So there's 2 types generally of irritable bowel disease. There's Crohn's, which can happen anywhere in the GI tract, from the mouth all the way to the anus. They tend to have different types of lesions that will be seen on the CT scans. They're called skip lesions, so it's not usually a continuous area of the colon. You can have different areas within the small intestine or the bowel. They tend to be very pro-inflammatory on Crohn's, and it can actually go through the colon wall and cause what are called fistulas, which is where it can actually adhere to other portions of organs within the abdomen, so like to the bladder, or actually there are some fistulas that can actually go down past the rectum and out through the skin. It can be very, very difficult to treat. It's very complicated sometimes. Ulcerative colitis tends to start from the anus and work up. Not that it's always going to work up, but that tends to be where it's located more so. It's not generally past the colon for sure. It doesn't involve the small intestine, and never higher than that. It never even usually gets into the small intestine. Ulcerative colitis can actually be cured with surgery. It's extreme because it's removing the entire colon. But it is the one of the two that actually can be treated with surgery. Irritable bowel disease, you can have surgery, but it's really more for the damage component that's happened from the disease process. So if you have chronic inflammation, you can develop a narrowing or called a stricture. And if that starts to cause bowel obstruction, sometimes those sections of colon are removed. But it doesn't treat the disease process at all. It doesn't actually cure anything, it's just a symptomatic treatment, basically. Both are diagnosed on colonoscopy, and both are guided by GI for Crohn's and for ulcerative colitis. You need a specialist generally to be treating these symptoms. IBS potentially can be treated by your primary, but you would want to at least have that colonoscopy to rule out that it's not something more severe. And there's some more information on a handout in there, but there's so much on these, especially irritable bowel. There's this whole gut-brain axis that's very important in that whole component, and we'll touch a little bit on that. Go past the CT. Oh, I'm sorry, I'm going backwards. I apologize, my baby's on the wrong side. So, to touch a little bit on the gut-brain axis, this is a fascinating area of study, ongoing for sure, but there are a lot of discussions about how the gut microbiome affects the gut-brain axis. The gut microbiome can affect different, as we talked about, there's certain short-chain fatty acids that release certain, that improve the release of certain neurotransmitters and hormones. So serotonin is for mood, sleep, and helps with gut motility. Dopamine is also released and produced by a lot of the gut microbiome, the primary component of it. GABA, which is a calming neurotransmitter that helps reduce anxiety. Norepinephrine. I was surprised to find out that 90 to 95% of our serotonin is produced within the gut, which is just completely fascinating. And that's why it's so important to have a healthy gut microbiome, because it really, like we were talking about earlier, all those beneficial gut microbiomes really help your overall health. Mental health is actually being looked at. There are some, so I did actually take it out, but I was trying to make it, it was such a busy, some of these slides are so busy, but certain vagal nerve exercises are looking to reduce stress and actually depression that's been refractory to certain medications and treatments. They're trying to look at different ways of altering the gut microbiome or helping to feed them to help improve those, your mental moods. It's pretty fascinating. And the last thing I thought that was super interesting is we talked a little bit about immunity. So our gut is super involved in our immune system. So again, 70 to 80% of our body's immune cells are within the gut, which is just mind-blowing, you know, and it helps to train our immune system from when we're young and on. There's a lot of cells within there that are actually helping train our immune cells. That is just absolutely fascinating. It helps defend against harmful pathogens. It's deciding, again, friend or foe when we eat certain foods and toxins that go through, what needs to get gotten rid of and what needs to be kept. The intestinal barrier, Dr. Naylor talked about, that can be an issue with leaky gut. They help tighten what are called the junctions between certain cells within the colon so that you don't have this leaky gut releasing toxins into our bloodstream, which then increases your inflammation, which then increases overall systemic issues that you can develop. And like I said, the gut microbiome educates and trains the immune cells early in life and throughout, which I think is just absolutely fascinating. So it's important to take care of your gut, you know, eating fiber, doing probiotics, or eating the foods that actually supply those naturally is a great way to go for it. You can't you know, supplementation is always a good way to go, for sure, and, the information that Dr. Naylor provided helps guide us in that direction. And that is pretty much it.